Welcome to the We Level Up Treatment Center video series. In today's video, we will discuss gabapentin addiction signs. Gabapentin, which is approved to treat seizures, is frequently prescribed for conditions other than those for which it was originally intended, including anxiety and pain. Both an immediate release and an extended release version of gabapentin are currently on the market. It is most commonly consumed in the form of a pill. According to the available information on the medication, the half-life of gabapentin in most people is between 5 and 7 hours. The amount of time required for an individual system to break down a drug to a concentration in the bloodstream that is half of its initial or starting concentration is the drug's half-life. After 5 to 8 half-lives, gabapentin would have been eliminated from the systems of the majority of people. Considering that the half-life of gabapentin in most people is approximately 7 hours, it will take approximately 48 hours for the drug to be eliminated from the body. However, other factors can influence this process. For instance, the extended release forms of gabapentin would continue to release the drug over the course of time, thereby extending the period during which it would be possible to detect its presence. Gabapentin side effects. Gabapentin is a medication commonly prescribed to treat various medical conditions, such as seizures, neuropathic pain, and anxiety disorders. While it is generally considered safe and effective, there are some potential side effects to be aware of, including dizziness or drowsiness, fatigue or weakness, nausea or vomiting, headache, dry mouth, swelling in the extremities, mood changes or depression, difficulty speaking or slurred speech, coordination problems, memory or concentration difficulties, unusual eye movements, allergic reactions. If you experience these side effects, you must talk to your healthcare provider to determine the best action. Sometimes, adjusting the dosage or switching to a different medication may be necessary. How long does it take for gabapentin to kick in? After taking gabapentin for the first time, you should wait anywhere from 1 to 3 hours before experiencing any noticeable effects. However, the amount of time it takes for an individual to feel the full effects of gabapentin can vary depending on several factors. These factors include the individual's age, weight, the severity of their medical condition, and the dosage that they take. Is gabapentin addicting? Can you be addicted to gabapentin? There is a possibility of addiction to gabapentin. Even though the DEA does not consider it a controlled substance, there is still a risk of abuse and addiction. Some people can become physically dependent on the drug, in which case they would experience withdrawal symptoms if they stop taking it. Can you become addicted to gabapentin? Because it can amplify the effects of other drugs, such as opioids and benzodiazepines, gabapentin can lead to the development of an addiction. Additionally, it can produce feelings of euphoria and relaxation, both of which have the potential to lead to psychological dependence. In addition, taking gabapentin in high doses can lead to physical dependence and withdrawal symptoms, which increases the likelihood that one will become addicted to the drug. How long does it take to get addicted to gabapentin? Gabapentin is offered in the form of an immediate release or extended release tablet. The efficacy of either formulation is contingent upon various factors, including but not limited to age, renal function, and concurrent pharmacotherapy. The onset of gabapentin's effects may vary due to its diverse indications. Typically, sleep disturbances caused by neuropathic pain may exhibit amelioration within a week. However, alleviating the pain itself may require up to 2 weeks to become perceptible. The reduction of seizures can typically be observed within a few weeks of initiating gabapentin treatment. The amelioration of symptoms associated with restless leg syndrome or postherpetic neuralgia, a type of nerve pain that occurs after an episode of shingles, may require a period of several days or weeks to manifest. Factors affecting how long gabapentin stays in your system. Despite not being categorized as a federally controlled substance, gabapentin has been subjected to regulation by certain states in the United States as a result of its growing misuse. According to a study, the incidence of gabapentin misuse and abuse was estimated to be between 40–65% among individuals with prescriptions and 15–22% in opioid-abusing populations, in contrast to 1% in the general population. The elimination half-life of gabapentin in the human body is approximately 45 hours. Several factors have been identified that could potentially affect metabolism. Gabapentin builds up in the body when it is taken in large amounts. If you take a lot of it, it might stay in your body longer. Gabapentin stays in the body longer when used more often because the concentration of the drug in the blood rises. Age. As people age, their kidneys work less well. Since the kidneys break down gabapentin, the process takes longer for older people. Health in general. The amount of time gabapentin stays in the body is directly related to how well the kidneys work. Gabapentin can stay in the body for up to 28 days without dialysis in people with kidney failure because its half-life can be as long as 132 hours. Gabapentin abuse treatment. Gabapentin abuse can be treated with medication-assisted treatment, behavioral therapy, and support groups. Treatment plans are tailored to the individual and may include detoxification, medication management, and counseling to address underlying issues related to substance abuse. It is important to seek professional help to develop a personalized treatment plan for gabapentin abuse. Please do not try to detox on your own. The detox process can be painful and difficult without medical assistance. However, getting through the detox process is crucial for continued treatment. We Level Up NJ provide proper care with round-the-clock medical staff to assist your recovery. So, reclaim your life, call us to speak with one of our treatment specialists. Our counselors know what you're going through and will answer any of your questions. That's it for today. Please subscribe and hit the notification bell. Like, share, and comment. We would love your feedback. Have a great day.